Well, Health Minister Joe Phaahla briefed the media and the country earlier on about our fight against the COVID-19 infections. Heidi Jokos has been following the health briefing. She joins us live now for more. Heidi, thank you for your time. We appreciate it. First off, have we learned anything new about the demographics of those who are getting infected?
It's important to highlight that it's still very early and data is, of course, being collected, and the various hospitals, of course, need to make sure that they analyze and make sure that they have the correct data to present to South Africans. But what's important to highlight is the fact that we do understand that those that are unvaccinated are most likely to be hospitalized. And we also do understand that when people are hospitalized, it's a lot shorter stay and it's not as severe. But what's important to highlight is the fact that those between the age of 20 to 39 years old are most likely to be hospitalized and are being hospitalized, and as well as the 40 plus. Now, you would ask the question, why this age group? It's most likely got to do with the fact that what they are picking up is that these are the people that are unvaccinated. You are seeing a slight increase in those 60 and above being hospitalized, but nothing too serious or too alarming. And this has completely shifted to what we saw during the second and the third wave, with the 60 and above, the most vulnerable age group, being hospitalized. Why is that? It's because the vaccines weren't easily available back then, and we weren't administering as many as vaccines. It's crucial that the Department of Health, together with the scientists, come out with this data to make South Africans understand that, in fact, the vaccines do work. They prevent against severe infection and hospitalization. So even if you are hospitalized, it's very mild and it's a very shorter stay compared to what we saw during the second and third wave.
Vaccination's obviously extremely crucial, like you say, because they are still providing protection. So what's the update on booster shots?
So what we do know is that as of yesterday already, those between the ages of 12 to 17 years old can go for their second Pfizer shot. This is, of course, in line with the fact that the medicine regulator, SAHPRA, approving a second shot for those between the ages of 12 to 17 years old. We do know that it has to be 42 days after you've received your first Pfizer shot. So this is why they're already starting to administer as of yesterday. Those that received their second Pfizer shots, so those that are 60 and above, are most likely to be first in line to receive their third booster shot. This will begin on the 28th of December because it has to be about 6 months after you received your second Pfizer shot. This is going to be a booster shot, so it's not primary vaccination, as the Deputy Director General, Dr. Nicholas Crisp from the Department of Health, explains. So it will be a booster shot. It shows that it provides more protection, especially in the vulnerable age group, which is 60 and above, and they were, of course, vaccinated a lot earlier in the year, and there needs to be a little bit of a boost and extra protection that is provided. Again, it's important to highlight that there is no evidence at this stage to suggest that the vaccines administered at this present moment do not provide some kind of protection against Omicron and severe infection. So yes, you can be reinfected with COVID-19 even if you are vaccinated, but it's mild cases. And this is why they are advocating for vaccines to be administered as quickly as possible for those that have not been vaccinated, because it does prevent against severe COVID-19 and death.
Heidi, very quickly, I think we're all anxiously waiting for the next family meeting. Any idea when that might happen?
So we were all predicting that it would possibly be this weekend, but according to the health minister, I think he dropped a bomb that nobody was really expecting. We do think that it's probably only going to be next week sometime, because the health minister is saying that the NCCC will meet probably next week, Tuesday or Wednesday, and the Department of Health giving them the recommendations that they believe will provide the sufficient coverage and proof, the sufficient recommendations rather, for what can be expected in terms of stricter lockdowns, if at all necessary.
All right, Heidi, thank you so much for following that update from the Health Department. We appreciate it. Heidi Jokos with the latest from the Health Department on our fight against COVID-19.